Hi, this is Steven Skaggs, and I'm performing my final physical assessment today. Prior to the exam, I've gathered equipment, provided privacy, proper lighting, washed my hands. Today, I have a Caucasian male with me, and he seems to be in good general appearance, no obvious signs of distress. Alert. Can you tell me your name?
Austin,
Your date of birth?
4/6/92.
All right. Why are you here today?
A physical assessment.
And today's date?
It's October 12th, 2014.
Fantastic. Oriented times 4. Height and weight is appropriate. Body is symmetrical. No obvious signs of deformities. Walking into the room, his gait was smooth, even, and balanced. All extremities seemed to move well. No involuntary movements. Clean, well groomed. Skin is consistent with ethnicity. And his head, to start the exam, looks normal, cephalic. Let's just see here. I'm just going to palpate your scalp here and kind of feel your cranium. Any tenderness?
No.
Good. All right, no lumps or anything were found. Hair is clean, non-brittle. Face is symmetrical, looking ahead there. Let's see here. Temporal pulse is good, strong at 2 plus. Can I have you say ah real big? And then close, then open, and close. Very good. No popping motions were felt. Any tenderness with that?
No.
Good. All right, now I'm just going to feel. Tell me if you feel any tenderness or pain.
No.
Good. All right. Next, we'll go ahead and look at the eyes. The first test we're going to do is the confrontation test. And I'm going to grab a piece of paper here. And I'm going to have you cover one eye. So you're going to do, yep, just like that. And I'm going to cover the same eye. Okay. And then I want you to tell me when you see my finger, okay?
I see it.
All right. Then we're going to do it on the other side.
I see it.
All right. Go ahead, you can take it down there. And the next I'm just going to look at the corneal light reflexes. So just look straight ahead at me, and I'm just checking to see where the light falls on both of your eyes. Good. And it's in the same area on both of the eyes there. Okay. Next, I'm just going to have you keep your head straight, and then just watch the tip of this and follow it in the direction it goes. Good. All right. And that's just looking for the cardinal positions. The next, I'm going to do the cover test. I'm going to have you just look straight ahead at me and just look straight at this pin here, okay? There we go. At this time, we'd also do the Snellen eye chart, which we don't have here. But essentially, I would just have him stand 20 feet away from it, and I would shield one eye with a piece of paper and have him read down to the lowest level that he could, and then try one level lower to find out what his vision was. All right. Next, we're going to do the light and accommodation. I don't really have a way to darken the room, but essentially, I would just test the pupils. I'm going to have you look over there at the corner of the room, and then look at my pin here. And then look back at the corner of the room, and then back at the pin. All right, and we're just looking to see that his eyes focus on the same. Okay, next I'm going to just check your sclera. So I'm going to have you look up towards the ceiling. Good. It's nice and white. His conjunctiva is pink. Let's see here. I'm going to look at the sides, look straight ahead at me. Okay. And the corneas look good too, smooth, clear. Pupils are the same size.
And right.
All right. Next, we're going to just kind of look at the skin in general. which is smooth, firm, no edema present in the extremities. Let's see here. Looking at the hands, color is consistent with ethnicity. Capillary refill is less than 3 seconds. Nails look good, well kept. Right. Posture, standing and sitting, has been fine. Affect is appropriate for the situation. He's been calm, cooperative. Speech is clear, spontaneous, appropriate. Any difficulty with hearing?
No.
No? Any changes in weight recently?
No.
Good. Do you have a decent appetite?
No, I'm good.
Okay. All right. Food allergies?
No, I don't have any.
Fantastic. Next, we'll just kind of look at the ears, which are symmetrical, no swelling or thickness, it looks like. Okay. And then taking the otoscope, I'm going to have you kind of tilt your head that way a little bit. Perfect. And I'm just going to look inside here. All right. That looks good. Any tenderness when I was touching the ear?
No.
No? Okay. Once again, the inner ear looks good. Outer ear as well. Okay. The tympanic membrane was also within normal limits. Next, I'm just going to do the whisper test, and this is just to test hearing. So just repeat what you hear, okay? Let's see here.
1, 2, A.
Good. And then on this side.
3, 4, B.
Fantastic. All right. Let's see here. Next, we'll go ahead and look at the nose, which looks symmetrical in midline. I'm going to have you just look upwards for me. Good. All right. And the septum is also midline. No lesions or discharge noted. Okay. I'm going to have you close one nostril, inhale, and then the other. Very good. Any difficulties with breathing with that?
Nope.
All right. Next, we're going to look at the mucosal membranes in your mouth. So I'm just going to have you open up wide. Say, ah. There we go. Okay, and stick out your tongue for me. Very good. And stick your tongue to one side. Good. And the other side. And then touch the roof of your mouth. Very good. Can you smile real big? Alright, just checking the gums, and they look fine as well. Okay. Next, I'm going to have you go ahead and stick your tongue out and say, ah. Okay, and the uvula is also midline and moves appropriately back. Next, we're going to go ahead and check your lymph nodes. Good. All right. And those feel fine as well. The trachea. Okay. And that is midline. And then the thyroid, which I'm going to do from the back side. Essentially, I'm just going to push it to the side. Feel. There we go. Very good. Okay. Then next we're just going to feel for the carotid pulse, which is nice and strong and equal on both sides. We're going to look at the neck here, which looks midline. It's supple, no lumps. I'm going to have you move your head side to side. Good. And then forward and back. And look to the left and right. Very good. Alright, so range of motion is fine. Next, we're going to go ahead and look at the chest. The thoracic cage is fine, not barrel chested, anything like that. Let's see here. Now we'll take a look at the spine. Spine is midline. Take a good breath for me. And exhale. Very good. Next, we're going to test here for tactile firmitis. I'm just going to have you say 99.
99. 99.
Again.
99. 99.
Very good. Next, I'm going to take my reflex hammer and we're just going to do a little percussion here. Good. I'll also go ahead and listen to your back while I'm back here as well. Every time you feel my stethoscope, just take a good breath. Very good. All right, we're going to do the same thing to the front side. Okay, so first we're going to go ahead and say 99.
99. 99. 99.
Very good. We're going to go ahead and do a little percussion here. Almost done. That's good. All right, we're going to go ahead and just take some good breaths for me while I'm watching. Good. And while I have my stethoscope out, I'll go ahead and listen to your heart. So we'll do the aortic, pulmonic, the tricuspid, and your apical or the mitral valve here. And the rate is regular. One more test we will do is the whispered ventriloquy. And what I'm going to have you do is just say 99 but in a whispered voice every time you hear my stethoscope on your back.
99. 99. 99. 99.
Very good. And that was the expected findings as well. Was not able to hear that while listening with the stethoscope. Okay, next we're going to do the upper extremities. So I'm going to first feel your pulses here. Very good, strong, 2+. We'll also feel at the brachial, which also feel good. Okay. We'll go ahead and do your hands first. So I'm going to have you bend at the wrist. All right, and then back up. And then bend your fingers. Spread the fingers. Back together and make a fist. Good. I'm going to have you touch each of your fingers to your thumb. Very good. All right. And then if you can move your hands sideways for me. Very good. Next, we're going to go ahead and do the elbow range of motion, which is going to bend up and down. Good. And then side to side. Very good. And then outwards and inwards. Very good. Okay, we'll go ahead and stand up. And I'm going to have you do your shoulders next. So arms out in front of you, and then behind you, and then out to the sides, and then back behind your head. All right. And then go ahead and put them back down. And I'm just going to have you shrug against resistance here. Good, and no crepitus is felt. All right. Okay, next we're going to inspect the abdomen while I have him laying down flat here. And just while looking at it, and how you put your arms at the side here, the abdomen is rounded and no bulging masses or anything seen. I won't have him take off his shirt or pull his shirt up or anything, but we'll just work with it. Let's see here. It looks symmetrical. And skin color is consistent with ethnicity, no umbilical cord, hernias, discolorations. It's inverted in midline. Gonna go ahead and auscultate the bowel sounds. Going in a clockwise motion. Also listening for venous sounds as well. No bruits are being heard. And bowel sounds are normal active. All right. Next, we'll do the scratch test to try to identify the liver borders. All right. And the liver borders were not able to be heard with the stethoscope, which is a normal finding. Next, we'll go ahead and palpate the abdomen. So I'm going to have you bend at the knees a little. Perfect. All right. And just breathe slowly. We'll do light palpation first. Next, we'll do a little deeper palpation. Any tenderness or pain with that? No. All right. Next, we'll go ahead and feel for the liver. I'm just going to put my left hand behind his back, and with the right hand, we're going to feel along the rib cage while I have you breathe in and out slowly. And that feels within normal limits as well. Next, we'll go ahead and do the spleen. I'm going to go ahead and put my hand back behind your back again. And this time, we're going to kind of feel upwards towards the axilla on the left side here. And take a good deep inhale for me. Just kind of feeling right along the line there. And it's not felt either, which is normal. Okay, next we're going to inspect the lower extremities, which the legs look symmetrical, color and hair distribution is fine. Let's see here. No varicose veins noted, and no swelling or lesions either. First, we'll go ahead and feel for the popliteal pulse, which is behind the knee here. And then the other side as well. Good. I'm going to feel for the posterior here. And then also on the top of the foot. All of which are normal pulses, 2+. Okay. Next, we'll go ahead and do range of motion. The first thing I'm going to do is have you to extend this leg straight up, and then back down, and then this leg. Very good. And then bend your knee to your chest, and then the other leg. Very good. And then try to keep this part staying straight, but kind of roll your hips towards the window there. and then towards me. Good. All right. Next, we'll go ahead and we saw that the knees were able to bend and extend fine. So we'll move on to the ankle and feet. I'm going to have you point your toes towards your head. Good. And then towards the wall. Very good. And then kind of see if you can move your feet inwards and outwards. Very good. Yep. And then I'm going to have you flex your toes for me. Wiggle your toes. Very good. All right. For the next portion, I'll have you stand up. Okay. And I'm just going to look at your spine. So go ahead and turn around. Good. And I'm going to have you bend forward. Good. And bend forward a little further. Very good. And the spine looks straight. No curvature to it. Let's see here. I'm going to have you stand back up straight. Good. And kind of bend backwards a little. Good. Then I'm going to have you to move your shoulders forward. Kind of slouch there. And then shoulders back. Very good. All right. And then kind of twist them side to side. Very good. All right. Next, we're going to do the Babinski reflex, which I'm going to take my hand and just run my finger across the ball of the foot and the lateral side to see if the toes splay or if they stay together. And they were a normal finding, staying together. Okay. Next, we'll go ahead and while you're laying down, do the pin to heel, the heel to shin. I'm going to, take your heel, put up right here, and then follow your shin down and back up. Very good. And now with the other leg. Great. You can go ahead and sit up now. Okay, next we'll do the rapid alternating movements. I'm just going to have you do this, and then back on the other side, and just do that faster and faster. Very good. All right. Next, we'll do the finger to nose. I'm going to have you extend your arms and close your eyes, and then take your index finger and touch your nose. Good. And then the other side. Very good. All right. Our next will be the sensation test. Actually, let's first go ahead and close your eyes, and I'm going to have you raise your hands for me. And I'm going to move your finger. Tell me if I'm moving it up or down.
Up. Down.
Good.
Down. Up.
Very good. All right. Now we'll go ahead and do the sensation test. I'm going to have you close your eyes and just tell me if you can feel when I touch different areas.
Yes.
And where am I touching?
My foot.
The other side.
My toes.
Very good.
My finger. My wrist.
All right. And then
My face. My cheek. My head. Forehead.
very good. All right. Did any of those feel different sensation, or were they all about the same everywhere?
About the same.
Good. Very good. Next, we're going to look at the brachioradialis reflex. So I'm just going to have you, there we go. I'm going to hold your thumbs with this hand here and just relax your arms for me. And then we're just going to a couple centimeters above the radial style here. Okay. Next, we're going to look at the patella reflexes. You can go ahead and relax that. And we're just going to, on the tendon here. There we go. And then the last reflex we're going to look at will be the Achilles tendon. And we're just going to tap and watch for the foot to flex here against my hand. Good. There we go. And the reflexes were fine and normal findings as well.